Hi everyone, welcome to Paws to Practice. I'm Mackenzie. I'm a vet nursing student who has been in this field for almost 10 years now. I've worked in small animal, large animal, and even done some exotics. Today's episode is going to be a little different. I know it's my first episode, but I think it's important to highlight on this. I want to talk about something that every vet professional and pet parent eventually faces, and that's grief. Um, Whether it's saying goodbye to a patient, supporting a client through a loss, or experiencing it ourselves, grief is a huge part of being in this career, and it does not get talked about enough. People always talk about how, like, oh, like, we must work with puppies and kittens all day, like, it must be great. That's like the most bare minimum thing that we do during the day. A lot of our visits are geared towards sick patients. We also do vaccinations. We do all kinds of other things during the day. And I wanted to really highlight on this today. So first, talking about the grief within as a vet professional myself. Working in this field, you form deep bonds, whether it's with patients, whether it's with the clients who bring their pets in every week for a nail trim, or clients that don't bring their pet in but like once a year for physicals and different things like that. So you're gonna build a connection, whether it's every few months, whether it's once a year. You're gonna build the connections, and sometimes you build connections really fast too. Like, it doesn't have to be someone you're seeing repeatedly. It can just be you really, really fell in love with this little puppy, or you fell in love with this senior dog that you did an appointment with. But every loss stays with you. From your first euthanasia appointment that you help assist with, to losing your first pet, to making the decision for that pet, to even running your first code. I remember the first time I did CPR, and it hurt really bad. Maybe someday I will share that story with you guys, but for now I want to stay focused on talking about grief within this field. So, like I said before, it does not matter if you've known this patient for years on end, if you started doing puppy vaccine visits with them, or if you're just seeing them for the first time. You will build a connection. Pets and people within this field can bond very quickly with animals, and it amazes me at how fast you can make a connection with animals, and it amazes me every day. But as a veterinary professional, we kind of learn to like hold space for other people's grief, and that sometimes ends up meaning that we don't really hold space for our own grief. Just because the pet wasn't yours doesn't mean that you won't grieve that pet, that you won't grieve or have empathy for the parents of that pet that are, going through that grieving process. So sometimes when we're busy, we are going from a euthanasia appointment to a 6-week-old puppy vaccine. Like, it happens. Sometimes it's really hard. Some people usually can't run those appointments back to back, and that is okay. But, take your time, learn what you can and can't do for that, because it is two different spectrums, and it's super important to know that and to understand those different things. Because when I was doing those busy days where I would be in a euthanasia appointment at the same time of going into a vaccine appointment, a puppy appointment, another sick appointment, it gets a little jumbled, and you kind of feel like your whole heart isn't in that new room, because part of your heart is with the grieving parents. I say parents a lot. I am someone who I think I treat my own dogs like my kids, because I don't have children, And so they are my little kiddos. You will notice that I call them kiddos, kids. I will call owners parents more than I call them clients, because, they're a life that depends on you. It's a parent aspect. So, speaking of parents, understanding the pet parent grief is super critical for this field. So, pet parents often say, I don't know how you are in this field. I could never be in this field because of doing appointments like this. And they say that from a euthanasia aspect. That some people say that when you walk in to do a normal room. So saying like, oh, I could never work in this field because of the euthanasias. And, you just smile and you nod, but deep down, that we grieve with them, and that just because like we may not show it on our face doesn't mean we won't go home and cry later. Tip, most of us do. Or finding like a little broom closet. That's where it's at. Everyone has their days. Everyone does. Everyone needs that little space. But losing a pet isn't just losing an animal. It's losing a part of your family. It's losing the routine of walking them, feeding them, making sure they're good before you go off to work. It's making sure like they were a piece of your daily life in that aspect. And it's okay to miss them in small and quiet moments, because when you leave the hospital without your pet for the first time and go home, and if you don't have another pet, or even if you do have another pet, it will seem wrong. It will seem like something is missing. That's usually when, like, if someone doesn't cry during an appointment with those visits, and they usually do, which is absolutely okay. Absolutely, please. I will bawl my eyes out when it's time for my kiddos as well. But you won't hear, those little nails tipple tapping on the floor in the mornings or in the evenings when you get home. You'll no longer have to fill their water bowl or put food in their bowl, because they won't be there. And those small little moments are usually what hurt the most. The whole euthanasia appointment, yes, that will hurt. That will leave a lasting impact on you. But for me, my problem has always been the small moments of doing those simple tasks as a routine every day. So next, we're going to go into healing, boundaries, and how to move forward from this. So grief doesn't have a timeline, and I'm sure you've heard that 1,000 times. Whether you're a vet tech, a student, or a pet parent, the best thing you can do is give yourself permission to feel it without guilt. It is okay to cry. It is okay to throw a pillow, scream at a pillow. Don't throw at people though, please. If you need to throw something, I highly recommend rage rooms. I've heard they're fantastic for that. Because or you can do what I have done, and I started learning how to defend myself in martial arts and kickboxing and Krav Maga. It's something that has been an outlet for me. So find your outlet. Find something that you can do to get that emotion of anger out, because anger is usually the first to come. You'll be angry at yourself for not noticing symptoms. You'll be angry at, the pet for making you make this decision. You'll be angry at just overall life. But you've got to know that you will get over it, and it's okay to feel that way. For professionals, setting boundaries helps significantly. Debriefing with coworkers can also help. Having certain coworkers, we all have like that work bestie. Sometimes you just gotta do that. Sometimes you have to step outside and call your mom, call your dad, call your friend. Like, it happens. It happens to us all. Again, if you guys want to know like in-depth cases for me in particular, let me know in the comments, and I will share some of the cases None of the details, of course, but like just how it has affected me and then what I did in those moments. So, for pet parents, know that healing doesn't mean forgetting and throwing all of that pet's things away. It means carrying their love forward in different and new ways, whether that's a new hobby for yourself, whether that's adopting a senior dog, whether that's adopting a puppy. You know, everyone has their different ways. So, you know, just keep that in mind. Some people aren't open to doing it right after because it just feels wrong. But over time, you'll find out that sometimes that's exactly what, once you heal enough from that loss, you'll end up getting another one. So, as you can tell, I've loved this field. I've been in this field for years, and this field has so much love for animals, for people, just overall, it's great. But love usually and almost always comes with loss, and talking about the grief doesn't make you weak. It makes us human. If dogs could talk, it'd be great, and then we could learn so much more from them. But it is vital to learn those different things. So if you need a reminder today, you're not alone in the grieving process. If you lost a pet recently, if you know you're just really struggling with a loss from a patient that you had, that you were watching them one minute, you turned around and they had passed the next, whether it's a case you didn't get back from CPR, whatever it is, you are not alone. There are thousands of us out there that are constantly going through grief, and we just need an outlet, guys. Just find an outlet. So if you like this content and want more, there'll be more. Not all will be, you know, as serious as this video, but I wanted to get this one out of the way because I think it's something that's not talked about enough. So follow Paws to Practice for more real conversations like this about veterinary life, you know, pet parent tips, tricks, parent education, and just the overall heart behind animal care, and learning, you know, different things about diseases, parasites, all that kind of stuff to follow. But just please always give yourself grace. Always make sure to remind yourself that you are not alone. There are things out there, whether you need a grievance counselor, whether you get one specialized in the veterinary field, or whether it's a pet parent that needs extra help getting over someone that has passed. Please reach out. Do not be afraid. It is there as a resource for you guys. And as always, give a little love to you guys' pets at home for me. Till next time. Bye.